Okay, this is Biel's quick tour of the upper respiratory tract. The nares, or the external nares, are the nostrils entering into the nose. The cavity in the nose is called the vestibule. You have the three turbinates, superior, middle, and inferior, help swirl the air, warm it, moisten it. You have the opening of the auditory tube right here. On the posterior wall of the nasopharynx, you have the pharyngeal tonsil. The imaginary line right here, kind of posterior to the turbinates, would be the internal nares, or the choana. Coming down, this would be the divisor line between the nasal cavity and the nasopharynx. The auditory tube is in the nasopharynx. So the hard palate is right here, and the soft palate projects posteriorly from there. The most inferior region of that soft palate is the uvula. Coming down this nasopharynx, the bottom of the uvula being the divisor between the nasopharynx and the oropharynx. The oropharynx is what you see when the patient says, ah, they open their mouth, you look back at their throat. So what a layperson would call the throat would be this region right here. It's the oropharynx. You can see the palatine tonsil. There's two of these on the left and the right side of a patient's throat. On the back of the tongue is the lingual tonsil. You can see the epiglottis here, the epiglottis being the divisor between the oropharynx and the laryngopharynx. Coming down inferiorly, we have the true vocal fold right here. And like we said, this is the epiglottis. This would be the tracheal cartilage here. And this would be the cricoid cartilage here. So moving down past then, the true vocal folds, this is the trachea. If you go posterior, this is the esophagus posteriorly. And that's Biel's quick tour.